Hey there, let's talk about Medicare Part B and Giveback, and let's talk about what it is, how does it work, and all the details about it. Let's start with Original Medicare. Original Medicare consists of your Part A as an apple, that is your hospital insurance. Then your Part B is going to be your medical insurance. All right, so once you have Original Medicare, you have two choices. You can go on to the Medicare Supplement world, which is also known as a Medigap, or you can go over to the Medicare Advantage world, also known as a Part C. When you get on a Part C, I want you to always remember that they are different in every county, they are different in every state, and they are different in everywhere across the country. They're all built pretty much the same, but the co-pays, the networks, and all of those kind of things are going to be different, including a Part B giveback. What is that? A Part B giveback is going to be a reduction of your Part B premium that you pay, right? Because even though you're on a Medicare Advantage plan and you're giving your Medicare choices to a private insurance company, you still have to pay your Part B premium. With that being said, there are some carriers in some areas that will reduce your Part B premium for you. How does that work? When you choose a policy or a plan, whether it's an HMO or a PPO, and most of the Part B premium givebacks are going to be on PPOs. There's a couple out there that are with PPOs, but not very many. Most of them are going to be on HMOs. But how does that work? Let's talk about, well, first let's say Original Medicare is $185 for 2025, right? So when you get onto a Part B giveback program, they are going to reduce that $185 according to what they have in their policy. There are some companies, like in Florida here, that give up to $165 back for your Part B premium. So you would just pay the remainder. But how does that work? Do you have to write them a check? If you are taking Social Security, you will notice that your check will go up an extra $165 every single month. Unless it's in an area that doesn't, give that much. If it's in an area that does 40, then you'll notice that it goes up 40. So it just depends on the amount in your area. They have CMS and Social Security has 90 days, 3 months to get that all caught up. So if they don't do it the first month, they'll catch it all up on the second month or the third month. By the fourth month, you should have had all of your Part B premium taken care of, and it should be your regular Social Security minus the 185, but with a rebate, basically, right? So if you're only going to be paying $25 for your Part B premium, you will see all that money in your Social Security check minus $25, okay? So why would somebody want to get on a Part B premium give back? Obviously, because it's paying some of your Part B premium, right? The other thing is that I want you to remember that when you get onto a Part B premium give back, your copays are going to be higher. So if we have two HMO plans with ABC Medicare, one of them over here has a lower MOOP or max out of pocket. Max out of pocket is going to be the most that you're going to pay for the entire year for your healthcare costs with copays. It does not include your Part D as in dog drug copays, just your Part A and Part B copays. Now, if you are on that plan, you're going to notice that your MOOP or your max out of pocket is lower. So let's just say it's going to be $1,500. And then most of your copays are going to be a lot lower. A lot of your PCP or you're going to your physician is going to be $0. Maybe going to a specialist is going to be $5 or $10. All right. So, and then your hospital copays are going to be cheaper too. Let's just say that they have you pay 1 through 5 days in the hospital, and the copays, let's just use easy numbers, is going to be $50 per day. Now we are with that same company and we have a give back. Over here on the give back plan, your MOOP is going to probably be $3,500. Your copays are going to be a little different too. Your copays for the doctor is going to be maybe $5 or $10 or $15. The specialist is going to be anywhere between $10 to $25. Your in-hospital stay is now, instead of $50 on this other plan, it might be maybe $150 for the first 7 days instead of 5 days. So you can see where they would be a little bit higher. Why would a give back be good for somebody? If you are somebody that's fairly healthy, doesn't go to the hospital a lot, doesn't have to go to the doctors a lot, a give back is really good for you. If you are somebody that is in the hospital a lot, and when I say a lot, I mean, 1 or 2 times per quarter, then honestly, unless you've reached your max out of pocket, then a give back might not be a great idea for you, because you want to keep those co-pays low. You want to keep your healthcare costs low. And with that, a give back, sometimes if you're ill or you go into the hospital a lot because maybe you have diabetes or you have heart conditions or whatever the case may be, it's not going to keep your healthcare costs low. So do I suggest getting on a give back if they have them in your area? Absolutely, if you're healthy and you don't go to the doctors a lot. If you are going to the doctors quite a bit, and when I say quite a bit, I have some clients that I don't put on give backs because they go to the doctors 2 and 3 times a week, or they go, at least maybe 4 times a month. That's a lot sometimes. And, I have some clients that are in the hospital quite a bit, maybe once or twice, 3 or 4 times a year. That can be really expensive. So a give back really wouldn't do them any good, because it keeps their co-pays higher, and that means that their cost is a little bit higher. So we put them on the one with the lowest max out of pocket, the lowest co-pays, to keep that cost down. All right. If you guys have any questions about givebacks, Medicare, Medicaid, Social Security, put them in the comments and I'll be happy to answer them for you. You have a wonderful day.